for joining us today. My name is Helen Blue, and I'm the Programming and Partnerships Manager at Perry Library. I'm so pleased to be presenting this program in collaboration with Lexington Human Services, MGH-West, and Supported Living Incorporated, which is a nonprofit organization helping people with neurological disorders. And thank you to the Community Center for allowing us to use their space. I'd like to introduce Sarah Bell and Kelly Hussey, who have been outpatient physical therapists at MGH for over 15 years, now working as senior PTs at MGH-West in Waltham. I'm going to now pass the mic to them.
Thank you. I'm Sarah Bell, and Kelly and I, like she said, work at Mass General in Waltham. I'm going to tell you a little bit about our objectives for today. So our objectives are to discuss the importance of exercise and physical activity after a stroke, provide you with the current recommended guidelines for exercise, discuss some of the barriers to success with implementing an exercise program, provide advice about how to initiate and sustain an exercise program, and acknowledge safety considerations associated with exercise. Stroke, which is often called a cerebral vascular accident, is a sudden central nervous system impairment in which the flow of oxygen and nutrients to the brain is halted through a blood clot called ischemia or bleeding called a hemorrhage. It is the third leading cause of death in the United States and the leading cause of disability. 4 million stroke survivors are living in the United States, and more than 730,000 Americans experience a stroke each year. An individual who has experienced a stroke can have a wide range of limitations from minimal to severe. The side of the brain where the stroke took place controls the opposite side of the body. So if an individual experiences a stroke on the left side of their brain, then the right side of their body will most likely be impacted. Individuals can also experience a number of secondary conditions as well, including paraplegia, hemiplegia, decreased balance, and speech and memory issues, to name a few. Individuals who have experienced a stroke are at greater risk of having or developed several associated secondary health and wellness conditions, including hypertension, coronary artery disease, high cholesterol, diabetes, and obesity. We know that the majority of stroke survivors lead sedentary lifestyles, and their aerobic fitness measures tend to be lower. Worldwide, stroke survivors achieve an average of 5,535 steps in the subacute phase and 4,078 steps in the chronic stage, which falls short of the 6,500 to 8,500 steps a day that are recommended. And many don't meet the recommended activity level due to not knowing how they should be exercising. Some of the factors that influence the physical activity levels of stroke survivors include environmental factors like lack of access to resources, for example, ramps and wheelchair access to public spaces, handicap accessible bathrooms or exercise equipment, and difficulty with transportation are a few, and the cost of joining a gym or other activities or programs can also be an issue. In some cases, with respect to the structured exercise, they may not know what kind of exercise they should be doing and what kinds of equipment they could use, and have difficulty positioning their affected arm or leg onto the machines or the equipment. So sometimes it's an issue of getting the affected limb into a piece of equipment and knowing how to use that equipment correctly. There may also be an element of fear regarding the unknown or adverse events contributing to the avoidance of new activities. Sometimes just being motivated also is another issue. So we've talked about the impact of stroke on physical activity, but it also may be helpful to make the distinction between physical activity and exercise. So physical activity is any body movement produced by your muscles that results in energy expenditure. For example, vacuuming, gardening, doing laundry, cleaning your home. Whereas exercise is a subset of physical activity that is planned, structured, and repetitive, and has the objective of improving or maintaining physical fitness. Participating in a well-rounded exercise program that includes cardiovascular, muscular strength, and flexibility exercises can help increase function in all areas of life. In addition to improving overall cardiovascular fitness, strength, and flexibility, exercise can also decrease risk factors for a second stroke through decreasing hypertension and body fat and improving your blood lipid profile and glucose regulation. Exercise can also help function in the extremities that were affected by the stroke and increase the ease of activities of daily living. Before you initiate any exercise program, it is a good idea to discuss your health history with your doctor and determine if you do have any cardiovascular risk factors. Risk factors include your age, any family history of cardiovascular disease, smoking history, sedentary lifestyle, increased body mass, elevated blood pressure more than 130 over an 80, and elevated cholesterol levels. And if you have 2 or more cardiovascular risk factors or known cardiovascular disease, it's recommended that you have a graded exercise test prior to initiating any moderate or high intensity kind of exercise. So what kinds of exercise are important to include in your fitness plan? So a well-rounded exercise program is going to include aerobic exercise, strengthening, flexibility, and balance training. We're going to start by discussing aerobic exercise guidelines. The exercise guidelines for people post-stroke is the same as for other populations. The goal is for 3 to 5 days a week of aerobic training for 20 to 40 minutes at moderate intensity. The goal in developing an exercise program is to determine what is safe, but also effective dosage of exercise, and try to individualize it to meet the goals that you have and your capabilities to fulfill those goals. Ultimately, with the goal of establishing lifelong exercise habits. These exercise recommendations are for individuals with mild to moderate stroke severity during the subacute and chronic stages of recovery, and are based on the synthesis of information gathered for a literature review by Kim et al. From 2019. Recommended frequency ranges between 3 and 5 days per week and should generally start with 3 days per week and progress toward 5 days per week over time. The duration of the exercise sessions ranges between 20 and 40 minutes, with a gradual progression from 20 to 40 minutes as tolerated. If a duration of 20 to 40 minutes of continuous exercise can't be achieved in a single session, the duration can be obtained through multiple 10-minute bouts of exercise through the day. The intensity should be moderate and range between 12 and 13 on a 20-point rate of perceived exertion scale, which we'll discuss a little bit more later, and 40 to 59% of heart rate reserve, which we'll be discussing next. When someone feels that they're ready to progress their program, they should start first with either the duration or the frequency of the sessions, and then finally progress the intensity as able to tolerate.
Is there doing too much, like over an hour, or is there a limit?
So for higher intensity exercise, they generally recommend that you try to like 60 minutes is usually the limit of like a very high intensity exercise that they would recommend.
Okay.
And generally what they do is say that the frequency ranges between 7 days per week. The duration of the exercise bouts can approach 60 minutes, and the intensity can approach between 14 and 16 on the 20-point rate of perceived exertion scale, which is between 60 and 80% of heart rate reserve. So I'm going to talk a little bit about
Okay.
what that means.
Thank
Okay.
you.
So we know from many years of research that the intensity of the type of exercise that you do matters. So when they recommend 20 to 40 minutes of moderate intensity exercise, what does that actually mean? Intensity is a measure of how difficult or challenging an activity is. And there's a few different ways in which we can measure exercise or activity intensity. These include heart rate monitoring using a subjective scale of perceived exertion and the talk test. So I'm going to go a little bit more detail into each of these. One way of measuring the intensity of exercise is to use heart rate. So there are a few different formulas that are used to measure someone's heart rate range and what that should be when they're trying to achieve a certain intensity of exercise. So the method that is typically used is utilizing something called the age-adjusted max heart rate predictive equations, or calculating someone's percentage of what we call heart rate reserve. And so we recommend using the heart rate reserve method, which is what's been endorsed by the American College of Sports Medicine and the Academy of Neurological Physical Therapy. So these are the steps to calculate. It's a little bit of math. So the steps to calculate your heart rate intensity include first trying to figure out what your max heart rate is using Tanaka's equation, which is the 208 minus 0.7 times your age. Then the second step is to calculate what your resting heart rate is, which should be measured while you've been sitting quietly for 5 minutes, and you're going to count the number of beats in a minute. You can do that either by testing your pulse at your wrist, you can check it at your neck, do your carotid pulse, or if you have those little fancy Apple Watches, you can test what your heart rate is by hitting the little heart button on your watch or your Fitbit. The third step is to subtract your resting heart rate from that max heart rate to obtain your heart rate reserve. And then to get the target heart rate, what you're doing is multiplying that by the percentage of intensity that you're aiming for, and adding that resting heart rate back to that. There are some, there's on this link, we have, I think there's a link on here, or maybe we don't have it on there, but there's, yeah, there is ways that you can find a calculator online to do this for you, okay? And those people that are on beta blockers, we use a different equation for that, because the beta blocker's job is to lower your heart rate. So you're not going to be able to achieve that same kind of heart rate intensity. So there are some problems with using these age-adjusted heart rate max equations. And the problems with them are that there's a general decline in your heart rate max as you age. The equations are validated in healthy individuals, but not for people who have had strokes. The predictive equations can overestimate your heart rate max by 20 beats per minute in either direction because of the standard error. Female heart rate tends to decline more with age than our male counterparts. And studies that compared the age-adjusted max heart rate to your actual max heart rate measured with a metabolic cart during an graded exercise test, show a poor correlation even in healthy individuals. So with that, I am going to just go through what the calculations would be for a 75-year-old, just so you have an idea of what that would look like, okay? So if we did the calculations for a 75-year-old, their heart rate max would be Their heart rate max would be 155.5, and then estimating that their resting heart rate is 65 beats per minute, then we would figure out that their heart rate reserve is 90.5. And then from there, we're going to calculate that percentage of the target heart rate percentage range, looking at moderate intensity and high intensity. So moderate intensity is 40 to 59% of that value. So that would be between 101 and 118 beats per minute. And high intensity exercise would be 60 to 80% of that, which would be 119 to 137 beats per minute. Okay. So the American College of Sports Medicine recommends following these suggestions. The gold standard way to determine one's max heart rate would be to use the max heart rate from a graded exercise tolerance test, and to calculate that target heart rate using this to achieve that moderate intensity exercise. For many patients, it is difficult to complete a graded exercise test. So if you don't have that graded exercise test data, it's usually something a cardiologist or your doctor will suggest for you. You could use the rate of perceived exertion scale instead, which we'll discuss next. The heart rate zones also may need to be refined if you suspect there's some inaccuracy, which doesn't seem to correlate with your perception of how hard you are working. For example, heart rate not getting into the moderate or high intensity zones despite you feeling as though you are giving it your maximal effort, right? So when in doubt, it's best practice to trust the rate of perceived exertion scale and how you're feeling over those heart rate max formulas. So this is an example of the rate of perceived exertion scale. It's also called the Borg scale. And the original scale used a 60 to 20 scale, but now they've revised, some people have revised it to use a 0 to 10 scale to just make it easier. So using the RP scale, an individual would want to be working in the range of 11 to 13 or 4 to 5 for moderate intensity exercise. And so that correlates to feeling like you're working somewhat hard. And for very hard intensity, that would be from 13 to 16. And you would want, or 6 to 9 on the revised scale for higher intensity exercise. Another way to understand how intense you're working is through the talk test. So basically, the harder that you're exerting yourself, the more difficult it is for you to talk. This is probably the easiest way to figure out if you're working hard enough for exercise. For example, someone working at a moderate intensity is still able to talk, but they couldn't sing while they're exercising. But for high intensity exercise, you may only be able to get a few words out at a time. Okay. If you are experiencing any of these symptoms, there may be that may be indicative of cardiac intolerance. And if this is the case, it's important to stop exercise and contact your doctor. So some of those things might be pain suggestive of angina or unexplained nausea or malaise, shortness of breath at rest or with mild exertion, dizziness or syncope, which is passing out. If you have difficulty with breathing when you lie flat or at night when you're sleeping, any kind of increase in swelling in your ankles or in your abdominal area, rapid heart rate or feeling like you're, palpitations, increased weight gain in a very short period of time, or if you have a new heart murmur. So we've been talking a little bit about discussing the importance of exercise being the right intensity in order to see the benefits. There has been a lot of recent focus in the physical therapy world on something called high intensity gait training. Much research has been dedicated to this form of exercise. This is a kind of training you may encounter when participating in physical therapy rehabilitation. So what is high intensity gait training? So this refers to walking on either a treadmill or over ground at an intensity which increases one's heart rate to 70 to 80% of their max heart rate, or 60 to 80% of that heart rate reserve calculation that we did earlier. The Academy of Neurological Physical Therapy came out with these clinical practice guideline recommendations in January of 2020. And they summarize the evidence in support of high-intensity gait training for patients with chronic stroke, incomplete spinal cord, and traumatic brain injury. This guideline represents the current best evidence in the field of physical therapy and comprises the recommendations of 111 studies on the effects of high-intensity gait training in these individuals. Since that time, there's been a movement to adopt the recommendations from this paper into physical therapy practice. And there's also been a campaign known as the Intensity Matters campaign, promoting an increase in the intensity of exercise that we prescribe our patients in an effort to maximize the recovery of functional movement. This is a form of exercise that is best done under the supervision of a skilled physical therapist, as they can provide the advice, guidance needed to safely address any individual's specific walking and balance concerns. The studies in this review and this also in the guidelines, you should know that they excluded people with unstable angina or other unstable heart conditions, and people that had cardiorespiratory or uncontrolled cardiorespiratory or metabolic disease. And people that were not able to walk more than 50 meters prior to their stroke were also excluded from these studies, and people who had lower extremity weight-bearing limits. So much of the research used outcome measures that were specific to checking walking speed, and the research has found improvements in walking speed and distance compared to conventional physical therapy, better outcomes than lower intensity walking practice, and better than higher intensity impairment-based exercise treatments. The good thing is that it increased muscle activity without worsening spasticity and improved walking kinematics. There are also studies that found that patients who participated in this kind of training showed improvement on balance outcome measures despite not specifically working on balance exercises. So why do we see these improvements? Why does intensity matter? So likely the answer is neuroplasticity. Neuroplasticity is a process by which the brain encodes experiences and learns new behaviors. This results in the modification of existing neural networks, or the synapses, in the brain, which translates to actual structural changes to these neurons. Neuroplasticity relies on activities that are specific to the motor skill that's being trained, that provide enough intensity and are high in repetitions. And these are elements that are all part of the high intensity gait training and contribute to the neuroplastic changes that occur. So if you do work with a physical therapist after you've had your stroke, you will probably engage in this kind of therapy. The ways in which the higher level of intensity gait training are achieved is by manipulating the speed of the treadmill or the grade of the surface that you're working on. Having people walk in different directions. So you might be walking sideways on a treadmill or backwards on a treadmill or all over ground. Using a weighted vest or ankle weights to make things heavier so it's harder for you to move forward. Stepping on and over and around different obstacles, going up and down stairs, providing dual tasks or cognitive challenges while you perform these activities. So due to the intensity of this kind of exercise, it's best to work with a physical therapist who is experienced in this kind of therapy so that they can adapt the training to your issues, okay? Often a harness system is used to provide safety and to help with preventing any falls. And it's also advised that you have some way of monitoring your heart rate to make sure that you're achieving the right intensity. And this can be achieved by the use of a variety of different devices, including Fitbits, Apple Watch, those oxygen saturation monitors. Yep.
What's an example of providing a dual task?
So I might ask you to do some math problems while I have you walking backwards or giving me the names of capitals beginning with certain letters. So different things that have you working on a cognitive task and a physical task. Yeah.
Thank you.
And then the polar heart monitor, which can be like a chest strap or an arm strap that is connected to an app on your phone, is another way to monitor your heart rate. So in order to ensure we're providing effective and safe training, we perform continuous monitoring of our participants' responses to exercise. So we, oh, did I skip this? Oops, I already did that. So if walking is difficult, there's alternative ways to work on achieving the recommended intensity and dosage of exercise. These could include the stationary bike with arm or leg straps to try to hold limbs in place if they're not able to stay in place on their own. Recumbent stepper machines are very popular. Swimming. And then there's a series of online exercise videos that the American Stroke Association has put together that are actually by a physical therapist as well. Some additional things to consider when you're initiating an exercise program are to check with your doctor prior to starting an exercise program. And like I said, the exercise stress test is recommended if you have some cardiovascular issues. Make sure you're prepared for your workout. Take your necessary medications, take your blood pressure medications, your water pills. Make sure that you're drinking plenty of water. Wear comfortable and breathable clothing, okay? And make sure you're wearing a good pair of shoes for exercise. Also know how the medications that you take affect your body, you know, and your body's ability to exercise. So some beta blockers lower your heart rate. So it's important to know what impact that has on your ability to exercise. And monitor your blood pressure. Be sure it's not too high. So you don't want it to be 200 over 110 or too low, or dropping with a change of position when you stand up. And if you have sensation impairments, it's important when you're sitting on pieces of equipment to shift your position every 10 to 15 minutes to make sure that you're avoiding any kinds of pressure sores or pressure areas. So at this point, I'm going to pass the baton on to Kelly, and she's going to be talking a little bit about strengthening and other forms of exercise.
Hello. All right, so now that you know all about the aerobic exercise guidelines, I'm going to talk to you about strengthening. Research suggests that people who have had a stroke should build up to doing 8 to 10 strengthening exercises, primarily focusing on large muscle groups. There are several benefits to strengthening. A meta-analysis of stroke survivors from 2020 showed that resistance training, also same thing as strength training, is effective in improving some different health-related processes, such as glucose metabolism, meaning it could help lower risk of diabetes or help managing diabetes. It can also help improve things like blood pressure and heart rate variability. It can improve your body composition, so reduce body fat and increase muscle mass. And then it can also help with getting more muscle fiber activity. Strengthening can also help reduce spasticity. So some of you may be familiar with this term, but people after a stroke can continue to have some muscles that are overactive, which can make them tight and also weak. And sometimes it makes it hard for the certain body part to function properly. So common muscles this can affect are the biceps muscles in the elbow, some of the hand muscles, and also your calf muscles in your leg. So strengthening can reduce spasticity by using a process called reciprocal inhibition. So what this means is that if muscles are not functional because of spasticity, the opposing muscle group can actually strengthen and help reduce the spasticity and normalize that muscle tone. So if someone has spasticity in their bicep muscle in their elbow, then if you try to strengthen the triceps on the other side, that can help to reduce the spasticity. It's recommended to strength train both your unaffected side and the non-affected parts of your body from the stroke, because studies have shown that people after stroke can suffer not only from reduced strength or muscle force in the affected parts of their body where they had the stroke, but also in the other muscles of the body. So we just want to make sure that you try to do whole body strengthening. If you continue to have, let's see. Sorry, I'm trying to make sure I don't tell you more than you need to know. Muscle, I wanted to talk about, let's see, the large muscle groups here. I thought the picture might show better what that means, what large muscle groups are in your body. So these types of muscles are things like your quadriceps, which are the front of your thigh muscle, your gluteal, your glutes muscles, or your buttocks muscles, hamstrings, which are in the back of the thigh, back muscles, stomach muscles or core, and then chest. There's many different ways you can strengthen. If you like going to a gym or an exercise class, then you can use some equipment, but you can also exercise at home, either with some simple props like hand or ankle weights, or resistance bands, or your own body weight. There's some pictures here just showing different examples of exercises that we often give people to strengthen. In the bottom 3 pictures, those are exercises for the large muscle groups of your legs. So the bridging is lying down and lifting up your hips, and then standing up and sitting down from a chair is also a good example. And then the very top picture shows an exercise, a leg press at the gym that you could use for similar muscle groups. In terms of how much strengthening is recommended, from the research, we found that the frequency will range between 2 and 3 days per week is what's recommended. So you would generally start with at least 2 days a week and progress towards 3 days a week over time. You should leave a day of rest in between strength training sessions, but they can be performed on the same day as aerobic exercise, or on different days, depending on what you want to do and also how your body tolerates the 2 types of exercise. We talked about how it should target the major muscle groups and include about 8 to 10 exercises. You want to try to do about 10 to 15 repetitions of each exercise, and then do between 1 and 3 sets per exercise. So it's ideal to rest for about 2 to 4 minutes between sets and after you finish with strengthening each muscle group. So you've heard this word intensity quite a bit today. As far as intensity with strengthening, that's the question of how much weight should you lift, or how hard should you make the exercise. So in the research, okay, we're back. The research shows that they use something called the 1 repetition maximum. And so that is where they will have someone actually find the amount of weight that they can lift for a certain body part. So let's say you're doing a bicep curl, they would see what's the most weight you can lift in pounds and just do 1 repetition. And then they would take a percentage of that and prescribe your exercises for how much you should lift during your session. So this is used, again, in research, and also maybe with athletes or people that are very serious about their exercise. But for you and me, we can estimate this. We don't have to use the 1 repetition max. So what you can do is you figure out an amount of weight that when you do the exercise, you feel tired after, your muscles feel tired after about 10 or 15 repetitions. So my rule of thumb is you want to be able to complete at least 10 repetitions with good form at a slow speed before you begin to tire, or sometimes people will begin to sort of cheat and use body momentum to finish. So if you can't quite make it to 10, then you might be using too much weight and you would want to go down in weight for your next set. If you can keep going, it feels pretty easy, you can go more than 15, then you might need to use more weight in order to build up your muscle. So just wanted to mention some safety considerations if you're doing a strengthening program. You want to make sure you learn how to do exercises properly and maybe work with a trainer or a friend that has experience. Make sure not to hold your breath while you're strength training. Instead, make sure you breathe out or exhale on the exertion, and inhale while you're going in the other direction. And make sure that you are taking it nice and slow, taking deep breaths, and try to keep good posture during your exercises. If you have some weakness in one hand, but you have some muscle activity in your arm, some people will use a splint on their wrist or hand to help with grip and performing exercises with weights. And if you use a leg brace, such as an AFO, you could use it in the gym to prevent injuries or falls. If you are going to go into a gym and use equipment, it's helpful to have one of the trainers show you how to use it. Make sure you get on and off properly without losing balance. But mostly research has shown that this type of exercise is safe for people after a stroke, and it's recommended as long as you are just being careful and trying to avoid any injury or falls. Okay, so now I'm going to move on to flexibility guidelines, which is talking about stretching. And you can see the goals listed here for stretching. Stretching can help increase your range of motion, prevent contractures, and decrease your risk of injury. It can also improve your ability to perform activities of daily living. Muscle contractures occur when muscles have been very short and tight for a long period of time, and it can end up limiting how much your joint can move and also your ability to function. So that can often happen if people have had long-standing spasticity. So again, I'm using the bicep as an example. If people can get where if you're not stretching regularly, the elbow eventually can lose range of motion and won't be able to straighten out all the way. And that can affect how much you can use that arm. So stretches can be static, where you hold your body still to stretch a muscle, or it can be dynamic, where you're actually moving your body to stretch. The static stretches should be held for about 30 seconds. They should not be painful, but you might have a slight feeling of discomfort. The research shows you should aim for at least 2 or 3 days a week to maintain your flexibility. Although if you're looking to increase your flexibility, then you should really try to shoot for closer to every day. And then I wanted to mention that there was a review on the effect, a review study on the effect of chronic stretching in people with stroke. And what they found was that the longest intervention, which was 1 year of daily stretching, reported changes in the muscle thickness and in the improvements in the range of motion. But the shorter interventions that were about 3 months did not show improvement. So basically, this just means it's better to continue stretching for longer periods of time. Other types of things you can do are things like yoga and Tai Chi have been reported to be beneficial in improving flexibility. And they also, as some of you may know, if you've done these types of things, they not only help flexibility, but also balance. And then studies have shown that they improve quality of life and mental health, and they also can reduce people's fear of falling. Okay, and then I talked a bit about spasticity. We talked about how it can lead to decreased range of motion, and just wanted you to be aware that sometimes it can increase if you're stretching improperly. And so if you need help with learning how to stretch these muscles, then that's where a physical therapist or occupational therapist could be really helpful. But in general, what we find is that weight-bearing stretches tend to work better. I'll show you a picture of what I mean by that. And that's because it helps giving some input to the muscle on the other side of the joint helps to reduce the spasticity and then cause an improved stretching response. So in terms of what parts of your body you should stretch, basically it's sort of, throughout you have your upper body, lower body, and your spine. And really any muscle groups that are not able to be strengthened, either, because of the effects of the stroke, those should be stretched, as I was mentioning, otherwise you can develop some contractures. And ideally it's good to stretch each muscle group that you might have used in a workout. Stretch both sides of your body and maybe spend a little more time on the tight muscle groups. So the weight-bearing exercise that I was talking about in this upper row in the middle column where the guy is sitting on the floor. You don't have to actually sit on the floor, but putting your hand down and putting some weight through your arm can help stretch the shoulder and elbow muscles. And then standing in the second row there with one leg forward is a good way to stretch your calves and also the front of your hip muscles. And then you can see that for spine, working on upper and lower trunk rotation is really beneficial because as we get older, we get some stiffness in different parts of our body, regardless of whether we've had a stroke. And you can see these changes in posture and flexibility can end up causing trouble with balance. So doing these things before they become issues is ideal. But even if you've already noticed some changes, then you can work on these to gain some motion. And speaking of balance, so endurance, posture, strength, and flexibility all contribute to balance. So the types of exercises we just discussed will all indirectly help you prime your balance system and your balance reactions to help prevent falls and to keep your stability. So as you get older and become aware of changes in your balance and your own personal risk factors, this is important to notice so that you can try to address them. Balance exercises are quite individualized, so we aren't going to necessarily talk about specific balance exercises or which ones to do. However, if you're wondering how your balance is and what you could do to work on your balance, we do suggest that you consider seeing a neurologic physical therapist for an evaluation. After we evaluate a patient, we design a program specifically for them to target the areas that we think are contributing to that person's functional problems and fall risk. In addition to giving patients exercises, we also can help determine if you might benefit from a new or a different type of assistive device to help preventing with falls, such as a cane or a walker or a walking stick. There are many different types, and so physical therapists are skilled at trying to help provide advice about what might be best for you. And the same goes for leg braces. If people do wear a leg brace, sometimes over time it ends up not fitting properly or providing the right amount of stability. And so we can help you decide if you might benefit from a different one or a new one. Lastly, if you do decide to try some balance exercises, in order for the exercise to truly target your balance system, you do need to be able to do it without using hand support. So this can pose a safety risk if you accidentally choose an exercise that's too hard. Therefore, if you do try to do these things, you want to make sure to do them in a safe location, potentially with someone spotting you for safety. And it's important to select the correct level of challenge. So we want to find a balance exercise that's not too easy, but not too hard. You need a bit of challenge in order to make improvements, but if it's so hard that you're losing balance right away, then you won't make gains. So again, this is why it might be helpful to see a PT help you pick the right exercises. If you're contemplating how to start exercising, or if you just want help modifying or updating your exercise program, then a neurologic PT can help with this. What you need to do for that, you might have already had some PT before. You can get a little refresher if you need it. You just ask one of your doctors for prescription to physical therapy and ensure that it's safe for you to start an exercise program. There's a link on this slide that brings you to a way to search for a neurologic PT in your area. I believe these slides are going to be also sent out to people via email so that you can actually click into the links easily. And if you're local, then you could come to Mass General Hospital in Boston or Waltham, where we have this type of physical therapy. If you want to try some exercise at home, this might be the same exercise link that Sarah talked about, but this link on the bottom right has some good exercises that show videos of how to do them that are good for stroke survivors. And you can also look into community resources to find exercise groups in your area to help keep you motivated or to try something different or new. We've partnered with NeuroFit, who I'll talk about more in a minute, to help our patients keep exercising in between episodes of physical therapy, and many of our patients have loved it. We have their contact information coming up in a couple of slides. It can be challenging to keep exercising throughout the years, but it is so important. There's been studies that have looked into ways that specifically can help stroke survivors keep exercising. And this slide here includes a summary of strategies that have been found to successfully keep people active. I know we're getting close to the end of our time, so I might just skip some of these things that I was going to say. But I'll mention that some people now use technology to track their workouts or steps per day. And so this can be very motivating for people and also keep you accountable for doing your exercise. If you're not a technology person, you could keep a written log of your workouts. And you want to try to make it a regular part of your life. So similar to your daily routine of brushing your teeth, you want to try to make exercise a part of your daily routine so that you can sustain it. However, if you do fall off your schedule for a few days or even weeks, don't think it's hopeless. Just start up and try again. We've included some tips here on how to keep exercising. I think I won't read all of them, but definitely read through it. Finding a friend, planning ahead, putting it on your schedule or in your calendar. These are some different ways that it can be helpful to keep you exercising. These resources listed here are handouts that give you information about, actually they're information for all older adults, not just people who've had a stroke, on guidelines for exercise. So we actually printed these and they're in the backs of your handouts. And I wanted to mention that there's community-based programs that are adaptive sports. So this is really just a fun way to stay active. I don't know if you've heard about Spalding, but Spalding Rehab Hospital has a wonderful adaptive sports program for people with all different kinds of disabilities to be able to participate in these activities in a modified way. So some examples are adaptive golf, wheelchair basketball, cycling, and sled hockey. The bottom link on this slide has additional adaptive sports programs all through the New England area. So this is another place you could click on to see what the options are. And so many of our patients, after they've had a stroke and they've done physical therapy, they have trouble continuing with exercise. And so for various reasons that Sarah mentioned earlier. And so there are these adaptive fitness centers that can be, basically they're an alternative to regular gyms in that they offer equipment that can be used by stroke patients or those in a wheelchair. And they sometimes provide supervision or personal training. In this area, we have NeuroFit. They have right here in Lexington. It's an evidence-based, they provide evidence-based exercise classes or personal training programs designed for people living with functional limitations caused by a brain injury or other neurological conditions. They have 1-hour sessions, which include aerobic exercises to improve cardiovascular fitness, functional exercise for strength and mobility, as well as balance and gait exercises. They have one-on-one instructions in order for people to achieve their fitness goals. And lastly, one resource that I wanted to mention to you is this center, the PT Center at the Mass General Hospital Institute of Health Professions. It's where I went to grad school for physical therapy, and they have this center that partnered with the Teddy Bruschi team or foundation for providing people with physical therapy who have had a stroke, who may not be able to afford physical therapy, or maybe their insurance coverage ran out. And so the link here can tell you how to apply to that program. It is in Charlestown, but it's a wonderful program to do if you are looking for more access to physical therapy. All right, and then this is a handy summary of some of the aerobic and resistance training guidelines that we mentioned to you for stroke survivors. And thank you so much for your time and attention.